Hey everyone, we're going to have an important in-studio interview. As you can see, it is, The American Dental Association has declared February as National Children's Dental Health Month. So I'm joined by the owner of Kids Tooth Team Pediatric Dentistry in South Austin, Dr. Alex Otto. Thank you for joining us. We did not call and coordinate our outfits this morning, but I love that we are twinning. Okay, so my first question for you, it's pretty obvious. Why is it important for us to think about our kids and their oral health?
Yeah, oral health is such an overall important part of your overall health. And so really your cavities and everything that happens in your mouth is really affecting everything that happens in your whole body. Yeah. For kids, cavities are different than they are for grown-ups, so it's really important for kids to have regular 6-month checkups starting at 1 year old, which a lot of parents don't know. It's that early that they need to get into the dentist.
Oh, wow. Okay. Yeah. So what can parents do to really make sure that they're keeping up with their kids' health? Like you said, those checkups frequently. Is there anything else that they should know about?
Yeah, frequent checkups, brushing 2 times a day, which I know is a struggle for a lot of parents. I'm a new mom, and so I totally understand that it's hard to do that 2 times a day. Morning and night, we need to be brushing. Flossing 2 times a day is great too. Using fluoride toothpaste at home is really something that we encourage as well.
Do kids typically have a lot of problems with their oral health?
So the Texas Health Institute labeled dental cavities or caries a silent epidemic. So over 2/3 of 3rd graders have cavities. So they've either had a cavity in their lifetime or will have one currently. So it's something that's a really common chronic disease of childhood, more common than obesity, diabetes. Dental cavities are a really serious problem that we don't often see. So it's really important, again, to go to your healthcare providers to see a pediatric dentist every 6 months, just because it's not something that a parent can look in your mouth and necessarily see a cavity.
And those cavities, as we know, it's uncomfortable, but can it lead to any long-term problems for kids?
Yes, for sure. So dental cavities in baby teeth can really lead to problems in adult teeth as well. So we really want to focus on those baby teeth when we have those. Kids have their baby teeth until they're 12 or 13 years old. So it's not something that they fall out, really early on. It's something that they're going to have for a long time. And they get their grown-up teeth as early as 6 years old. So really at an early age, we're having permanent teeth in our mouth that we're going to have forever and really need to take good care of.
I got to ask, because Valentine's Day is coming up and I'm a chocolate girl.
Yes.
Should parents limit the amount of candy that their kids are eating even on holidays?
Yes, sugar is really the culprit of dental cavities. And so, of course, anything in moderation is okay, chocolate is something that dissolves a little bit easier than the really sticky candies. So really trying to minimize the really sticky candies. Those are really what can cause cavities and get stuck in the teeth.
Okay. How old is your kiddo, by the way?
He's 5 months old. So
5 months old. So you've got a little bit of time before you have to worry about that.
Yes, exactly.
Awesome. Yes. Thank you so much, Alex Otto, joining us.
Thank you.
Important stuff, guys.